Hello everyone, welcome to Maple Dental Center. My name is Dr. Sophie. I wanted to take this opportunity, being that April is Oral Cancer Awareness Month, to take a few minutes and show you how important it is to come in to your dental visits and have the oral cancer screening done. Every hour, 24 hours a day, 365 days a year, one person dies of oral or oropharyngeal cancer. So screening is of utmost importance. Let's take a little bit of a drive and see what exactly entails an oral cancer exam. Victoria is our patient today, and with every exam, we go ahead and we do several things. First of all, we start outside and we look at the face, we look at the nose, we look at the eyes, we look for any symmetry that is irregular, we look at any swellings, anything that's out of the ordinary. Then we go ahead and we start our exam. Okay, so first off, we start on the carotid, where you have a very large muscle called the sternocleidomastoid. We go ahead and we palpate this, and what we're looking for is any lumps, any bumps, anything that is out of the ordinary or uncomfortable. We go right under the mandible and we come all the way down to the clavicle. Then we do the other side, again looking for the same thing. All this is done really quickly every time you come in for your recare or as a new patient in most dental offices here in Ontario, Canada, actually around the world. Standard of practice. Okay, we check under the mandible. Go ahead and swallow for me. And what we do, and sometimes it's hard to palpate the thyroid, but it's also very good to go ahead and palpate around that. Fantastic. Then we check behind the ears, and here, go ahead and open for me and close. Good. And open and close. Fantastic. Then we go ahead and now we move inside the mouth. And inside the mouth, we have various structures that we use as standard to evaluate. And open, we check the lips and make sure that there's no blemishes, no growths, nothing that, again, may or may not be normal. Then we palpate the cheek, checking for the parotids, any lumps, any bumps again, and around to the other side. Everything looks good. Fantastic. And then we say open a little bit for me, and we go bimanually and check underneath the floor of the mouth if there's anything there as well. Now understand that this is a video and I'm taking a little bit more time, but typically this shouldn't take more than about 2 to 3 minutes. And we check the soft palate. Fantastic. And we say and we check the oral pharynx, tonsillar region, make sure everything is clean. And the last but not least, la pièce de résistance, where 75% of all cancers in the mouth will appear, is underneath the tongue. So we grab the tongue and we evaluate it. We move it from side to side. We tug it. We assure the patients that they get it back. And we want to make sure in tugging it and checking, evaluating any discolorations, any wounds, any sores. Other than that, you give the tongue back. You tell the patient, you're great. So, important, please everyone, follow up with this. Let's just be aware, because the earlier you catch anything going on, the better the results are in the end. Enjoy the month of April, become aware, and visit your dentist.